My name's Mark McDonald. I was the Chief Operating Officer and Vice President for Ohio Heart and Vascular from 2001 through 2008. I've got approximately 28 years of experience in healthcare, 8 years on the physician practice side, 20 years on the hospital side, the last 12 in senior management.
Good.
When I was with Ohio Heart, we had 37 physicians, 8 mid-level providers, about 250 employees. We covered approximately 5,000 square miles, 18 clinical sites. We saw between diagnostic and office visits approximately 200,000 patient encounters a year. As we finished the implementation of our electronic medical record, we looked at a number of problems that were associated or kind of followed along with that implementation. One of the most problematic areas would be getting the dictation into the chart for the medical record. So we wanted to get the history of present illness and the chief complaint into the medical record. We had an in-house transcription service, 17 FTEs, and we were about 6 weeks behind in terms of getting that limited amount of transcription into each of the office notes in the chart. We began to look at different alternatives and evaluated really several companies before we determined from a service standpoint, a quality perspective, and cost that we wanted to move towards outsourcing, and we selected CardioScribes as our partner. When we went through the transition process for about 30 days prior to the actual transition, we briefed our staff. Staff had an opportunity to go with CardioScribes. If they chose not to do that, we would lay them off at that point. We worked with CardioScribes to develop an overlap so that we could continue to work down the backlog and get as much of the material in the record as we possibly could in as timely a manner as we possibly could. Then, as we switched over, some of the staff matriculated over to CardioScribes, and we went from approximately a 6-week delay to less than a 48-hour delay. When we looked at managing the transcription issue or the concerns we had with transcription, we had to work with a company that could meet the service factor, that could meet the reduction in the delay between the patient encounter and having the information available to the rest of the practice, and could interface with our medical record. And we used NextGen as our medical record. We made a conscious decision based on our evaluation of CardioScribe to allow that company to populate our medical record, which was a key component in achieving that turnaround and the reduction. We did do the financial forecasting, and we estimated there would be somewhere between $250,000 and $400,000 per year in cost reduction, in addition to the improved turnaround time and actually an improvement in the quality of the transcription as well. The cost savings were realized and have been presented to the board, and had been presented to the board at the close of the fourth quarter of 2008. The service factors, the reduction in the turnaround time, was realized almost immediately. We had less than 2 weeks where we were working through the transition. So one of the real hallmarks of this process was the way that CardioScribes integrated their process with our workflow, and we actually got a more effective product. I would endorse CardioScribes as an option for outsourcing transcription without hesitation. I think it was an excellent decision from a cost, quality, and service standpoint to the practice. It was very smooth. It was well thought out. We did, there are always problems that you encounter, but we worked through them. And we worked through them in a very timely manner, and the quality was always there. The physicians were more satisfied. The information was accessible almost immediately anywhere in our service area. It's, in addition to transcribing from the voice dictation, another feature was that the physicians that were doing their self-transcription, I guess, had their reports edited. And in effect, when they looked at them, they were reviewing clean copy rather than correcting their own errors. So I think right now most of them believe they're excellent typists, and they can continue to believe that. Yeah, of the 17 transcriptionists that we had, 12 chose to remain with cardioscribes. Of the other 5, at least 3 went with the hospital system. And we were able to place all those folks that wanted to be placed in a local setting. So it did help us avoid doing a layoff or executing a layoff, and certainly from a public relation or community public relation perspective, that was something that I wanted to avoid.